And welcome back to 10 News at 5. I'm Beth Haynes. An estimated 1 in 4 East Tennesseans is affected by mental illness. During Mental Illness Awareness Week, Peninsula Outpatient Centers is trying to spread the word about support services available through its wellness recovery centers, many of which are free. Sheryl McCormick is the coordinator of recovery training services for Peninsula, and she's here today to tell us more about it and the services that are offered. Thanks so much for coming on.
Oh, thank you for having me.
It's amazing. So many resources here in East Tennessee when it comes to mental illness. Let's talk more about the recovery wellness centers and tell us specifically some of the services out there.
Well, with the Wellness Recovery Centers, they are peer-run, and therefore peers, people who have a psychiatric diagnosis who are adults, who are able to follow the rules of the center, and the center's rules are actually established by the members. It's very interesting that we provide support groups, we provide individual support from the staff to the members. We have educational classes. The Wellness Recovery Action Plan, which is an evidence-based program, is one of our premier programs. We also go on outings. We were at the Community Day on Market Square Mall Friday, which was sort of a prelude to Mental Illness Awareness Week. We also teach people healthy living skills, so we talk about diet, exercise. We do a lot of physical activities, and mainly it's just a safe place for people to come to learn how to be in the world and to get over stigma and maybe reintegrate into society.
Is it open to anyone?
Anybody who has a psychiatric diagnosis. It's fully funded by the state of Tennessee through a grant, and that's the requirement for membership.
Talk about the most common mental illnesses.
Well, the most common would probably be the anxiety disorders and depression. Less common would be the more serious psychiatric diagnoses of bipolar disorder and schizophrenia. And there's a continuum, of course. But we, as you said, there's 1 in 4 people here in East Tennessee, anywhere in the world, that has a mental illness. And
the more conversations that we have, hopefully we can get over some of these stigmas and really get help that is needed by so many people. And let's talk more about these open houses this week.
Oh yes, we're so excited to have open houses at our Severe. That's going on today until 6 o'clock, so it's almost over. And then our Maryville Center, which is at 532 West Broadway in Maryville. And then our Knoxville Center is at our Peninsula Lighthouse location on Dow Springs Boulevard at 1451 on the upper level. We'd love to have people come out. The Maryville Center's open tomorrow from 1 to 6, and our Knoxville Center will be 3:30 to 7.
Wonderful. And you have such a unique perspective when it comes to mental illness and ability people can relate to you. You've actually battled mental illness. Talk about your experience and why you want to help others.
Well, it feels so good to be able to give back, and I have been the beneficiary of so many mentors and people who have helped me through the years. And my symptoms started when I was very young. I was in grade school, through the middle school years, and back then it was junior high, and through the high school years I was really having a hard time. I ended up running away at 14, getting married at 15, had periods of homelessness and all kinds of just about anything you can imagine, that poverty, and my husband and I are still married, happy to say.
Wow.
And but it was really difficult. I was in my 30s before I finally had the proper diagnosis, after multiple suicide attempts and many times with different psychiatrists over the years. Back when I first started having symptoms, they did not believe that people of my age could have bipolar disorder.
Wow.
And so I was misdiagnosed and, of course, mistreated as far as the treatments they were giving me. I don't mean they were abusive, but anyway, through the years, though, I hooked up with a really good therapist who taught me many coping skills, and I got on the right medications, and I started to learn about recovery. Partly through one of my mentors, Mary Ellen Copeland, who's the author of the Wellness Recovery Action Plan. And I've gone to conferences all over the world, and I have been so blessed for all these opportunities. And my NAMI mommies, NAMI, the National Alliance on Mental Illness, a lot of those ladies from that particular organization helped me so much. And I got an opportunity to be a facilitator of the Wellness Recovery Action Plan and teach people all over the state, providers and people who work in the field of peer support. That's a new emerging practice. And now I train peer recovery specialists all over the state for the state of Tennessee.
Well, we're so lucky to have you in East Tennessee and across the state helping in this battle. And also there's training. We were going to talk about law enforcement training, but also some training people can go through to recognize signs of mental illness. If people want to learn more, do you have a website?
Yes, we do. It's PeninsulaBehavioralHealth.org.
Okay. And we'll try to put that up on our website. Thanks so much for coming on and sharing your story. Appreciate what you do.
Thank you for having me.